Hi, my name's Kathy and I'm a speech and language therapist. I work with babies, children and young people who have eating, drinking and swallowing difficulties. Now you may be surprised to hear that speech and language therapists work in this area, but if you think about it, we use the same muscles for eating and drinking as we do for speech and communication, so it makes sense for us to be involved in this area too. As a team, we work with babies, children and young people with a wide range of difficulties. Babies may have difficulties breastfeeding or bottle feeding as they're learning to suck. Older children who are starting to wean may find it difficult to move on to harder, chewier textures, and sometimes children find it very difficult to tolerate textures in their mouths and they gag a lot. Some children might have difficulties with their muscles and the coordination of the musculature needed for eating, drinking and swallowing. And some children have breathing difficulties. They may need breathing tubes or even breathing machines. All of these factors and many other factors can make eating, drinking and swallowing difficult. Some babies, children and young people may have difficulty swallowing safely, and you might hear this referred to as dysphagia. If we suspect dysphagia is present, there's a possibility that food and drink might be going down the wrong way. That means that food and drink might be going down into the airway or into the lungs instead of the tube that leads directly to the stomach. We call this aspiration. Things to look out for with your child if you're concerned are things such as coughing, choking, spluttering on food and drink, face colour changes, so turning red, or eyes watering. Your child might also have a wet or a gurgly sounding voice or breathing as they're eating and drinking. Children who have these issues are a little bit more prone to chest infections, so it's important that we see these children quickly and see what's happening with them. The first time we meet you and your child, we'll be collecting some information about your child's early history and development. That'll include their feeding history and any medical details. In all likelihood, we'll also want to watch your child having something to eat and drink, and this is usually in your own home or possibly at school or possibly in hospital. We'll watch your child eating and drinking and look at how their muscles move, their tongue, their lips, their cheeks, and how they're swallowing. We may use a stethoscope to listen to your child swallowing, and this involves placing the stethoscope simply on their throat and listening as they swallow. In some cases, we may request more information about your child's swallow, and that involves a moving X-ray. You may hear this referred to as a video fluoroscopy. A moving X-ray, called a video fluoroscopy, enables us to see food and drink moving through the mouth, down the throat and into the child's stomach. It also enables us to see if food and drink is going down the wrong way, and that helps us in our management of the child. After assessment, we'll agree with you what needs to happen next. For some children, we may suggest changes to the textures in their diet, and that might include softer or easier to chew foods. We may also consider their drinking skills and suggest thicker drinks. Sometimes children will need a little bit of advice, and we can discuss the possibility of discharge at that point. How many times you see a speech and language therapist will depend on how difficult eating, drinking and swallowing is for your child, and how we can support you to manage this in their daily life. If you do have concerns about your child's eating, drinking and swallowing, then please contact our department to discuss a referral. You can also discuss your concerns with your health visitor or your doctor or any other professional involved with your child. Thanks for listening.